Welcome everyone to today's webinar. I'm Emily Rappley with Becker's Hospital Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. To submit a question, type it into your control panel in the space labeled Enter a Question for Staff and click Send. We look forward to hearing your questions. Today's session is being recorded and will be available after the event. In about a week following the webinar, we will be sending all registrants a copy of the presentation to the email you used to register. At this time, it is now my pleasure to start today's webinar by introducing our presenter. Mike Peluso is a career-long revenue cycle professional with advanced skills and expertise in the specification, development, and implementation of software technologies to accelerate the revenue cycle for health plans and healthcare providers ranging from small practices to large regional enterprises. Prior to joining Rectangle Health in 2013, he also held senior leadership roles with multiple revenue cycle technology companies. Michael's portfolio of accomplishments includes the establishment of the Rectangle Health Enterprise Solutions Division, which serves health plans, hospitals, and large multi-site physician groups by providing unique and customized patient payment solutions. He also migrated the Practice Management Bridge technology to a secure cloud-based platform that supports pre-authorized healthcare processes and the latest chip technology, credit and debit cards. Michael holds a bachelor's degree in health systems management from the University of Connecticut and has completed graduate level work in healthcare management with the same institution. At this time, I am pleased to turn the floor over to Mike to begin today's presentation.
Thanks, Emily. Good afternoon, everybody. Mike Peluso, Chief Technology Officer of Rectangle Health. I'm here to talk today a little bit about obstacles practices face with patient satisfaction and practice cash flow. And to kind of set the stage on some of those obstacles, we all know that the cost of healthcare is increasing. The cost of patient out-of-pocket responsibility is increasing. We know 1 in 5 insured Americans have difficulty paying their medical bills. We know half of uninsureds have difficulty paying their medical bills as well. The reality is, and I always call this the pile on the counter, medical bills don't get paid first. Medical bills happen to sort of fall behind after things like the mortgage bill or the electricity bill. For some reason, although the medical care is certainly important, I'm sure, to patients, those bills pile up on the counter and they don't get paid with the intensity as a normal type of bill. So really this problem, I think, is generated because the patient is so far removed from the process. They're not involved in the process, and the insurance companies have definitely gone through a process of creating things like deductibles and making it so that patients aren't directly connected to the provider that's delivering the care. There's this third party in the middle that we all know of, and that's the insurance company. And that insurance company has really helped to kind of create this problem, not only by increasing patient out-of-pocket, but by increasing premiums and kind of having a negative effect on the overall healthcare space. Couple of other proof of those obstacles, 45 million people have difficulty paying their medical bills in the past 7 months. The percentage of consumers enrolled in high-deductible health plans that I had mentioned has increased 500% since 2004. I think we'd all be hard-pressed to find a plan that doesn't include a deductible these days. And 45% of Americans, as I said, have a difficult time paying an unexpected medical bill of $500. That's the other sort of thing with the mortgage or the electric bill. It's expected, it comes every single month so that people are trained to pay those. But when they get this unexpected medical bill of, let's say, $500 or even $100, some portion of some deductible, it's kind of unexpected that they have to pay that, and then the whole process of the delay and the time it takes to get paid, especially for the provider and especially for the patient, gets extended quite a bit. A couple of other statistics, 68% of patients failed to pay off medical balances last year. That number is expected to grow into the 90% by 2020. 25% of families have an unpaid health care bill. I'm one of them, and I can certainly afford to pay all of my bills, but I have that one sitting at home on the counter that I haven't gotten around to, and I'm certainly looking to pay it. I just haven't gotten around to it. 20% are paying a health care bill over time. 10% have a bill that they're not going to pay at all. But to kind of flip around that statistic, 20% of all of this would be willing to put it on a credit card and pay over time, or just pay it off completely on their credit card. Why does this exist? And I certainly talked a little bit about this, but insurance companies definitely created a shift. Insurance companies took the bulk of patient responsibility, or the bulk of actually the money that's getting paid to providers, and made it into patient responsibility. And there's still a contracted rate, so a provider is still taking a discount. So if there's a $100 procedure done and the provider's taking a 20% discount and $80 is owed, well, that $80 used to get paid from an insurance company. Insurance companies with their actuaries and large employees, they created this idea where, okay, now that $80 is going to get paid from the patient. And I can do an entire sort of a whole nother presentation just on this one topic of how insurance companies were able to shift to these high deductible plans. They were actually able to keep premiums exactly the same, if not increase premiums, but sort of take the burden of collecting from that patient and convert it to the patient, or convert it to the provider to collect it from the patient. Again, to highlight that rise in high deductible plans, they've certainly gone up quite a bit, and as I said, they are becoming the standard. They're no longer an option. Everybody, except for probably large unions and maybe a few municipalities here and there, but everybody has a deductible. With some of the higher plans that, and we'll use the state of New York for example, some of their Accountable Care Act plans have $5,000 deductibles, and that's standard. But more and more people have an out-of-pocket responsibility because of these high deductible plans. And there are ways, and we'll talk about this, there are ways to kind of address how to capture payment from those patients. Overall, now that the provider is collecting from the patient, you're the face of the payment. Years ago, when it was a $5 copay, it wasn't so bad. Years ago, when there was a lot of push in from the insurance space, where you were getting a lot of the money from the insurance company, it wasn't so bad. But now the patient, the only time they're ever talking about payment, or the only time they're ever engaged about payment, is when they're at the office, right in front of the front desk person, maybe when they're scheduling their appointment, or on the back end when they get a statement from an office or they get a statement from a hospital. It's always it's never, although it's the insurance company that's creating the patient responsibility, it's never the insurance company that's assisting in collecting that patient responsibility. It's always pushed towards the provider to collect it because it's money owed to the provider, although it's contracted from the insurance company, but it's always pushed to the provider to collect that money, and really it creates a negative experience for the patient if it's not handled properly. The problem is definitely not getting smaller. Healthcare is one of the largest industries. It's actually the largest percentage of the GDP in the United States. It's not going away. Currently, medical and dental practices alone account for $881 billion in national healthcare expenditures. So the problem is continuing to grow. We spend more on healthcare than we do on oil, gas, food, clothing. So that it definitely needs to be addressed. And as I said earlier, it needs to be addressed at the provider office level or the hospital level or even the dental office level, where patient needs to be engaged about their payment. Again, a little bit more on sort of the overall trend and the overall expense in healthcare. By 2026, it will account for 19.7% of the GDP. Although over the past few years, patient balances overall have been declining, it is predicted that it will increase again due to a lot of these high deductible plans and things that I've been listing out for everybody. Despite all the negativity that I've been laying out, processes still remain outdated. There's a lot of paperwork for providers to get paid by insurance companies. There's a lot of paperwork to get that claim paid, or actually get that claim adjudicated, because a lot of times it's not going to get paid. a lot of times that claim is going to go out to an insurance company. Insurance company is going to adjudicate the claim. It's going to come back to your office, and it's going to say the patient owes the entire amount. Although a contractual amount was taken, although a claim needed to be submitted, it's going to come back and essentially say, go get the $80 from my previous example from the patient. So as we talk about a few things, we definitely talk about healthcare, but we also want to talk about the patient now being responsible for that amount of dollars that I spoke about. They're now really a consumer, and they want to be an informed consumer. We want them to be an engaged consumer, and we want them to understand that when you go to a provider office, when you go to a hospital, payment's expected. Healthcare is one of the few industries in the world where you can consume goods and services and kind of walk out the door without paying. We want to shift that. There is no other consumer experience that exists where a patient can go into, let's just say, a grocery store, fill their cart up with all sorts of groceries, walk to the checkout line and go, I'm not going to pay today, send a claim to my grocery store insurance carrier, see if they pay you, and if they don't pay you, well, then send me something at home, and I might pay you at that point in time, 60 to 90 days later. That doesn't exist in a consumer environment, and it really doesn't need to exist in the healthcare environment as well. 92% of consumers want to pay their responsibility prior to the visit. 70% want to pay for care before the bill comes, meaning that they want to, when they're at the office, they do want to pay. I think a lot of the medical practices are starting to realize this. Some of the more effective ones are starting to engage patients immediately right when they're at the office. And I think also patients are starting to say, wow, I do have to pay. I realize my health plan has a deductible. I realize I have an FSA, HSA. I do have to pay. So if that patient can be educated, that patient can be engaged at the point of care, they're certainly willing and able to make their payment. And the HSAs and the FSAs certainly help. I've heard patients say they want to pay. I have this card that I got from my employer. Although I do have a deductible of $5,000, I also have a HSA, FSA of $5,000. Consumers also want to be able to compare and understand what they're going to pay. This is actually, we call it the Amazon effect. Today, when somebody wants to buy something, whether they go to a store and buy it or whether they order it from a site that's not Amazon, normally when they Google it, Amazon's going to come back and say, the average price for a new t-shirt is $15. So then they have a benchmark of, okay, when I buy this t-shirt that I want to get, they're going to pay $15. So it's an Amazon effect in the consumer space, but in the healthcare space, the same thing can exist. If they're comfortable with somewhat of a price range, or they're comfortable with knowing that they have patient responsibility, they're going to be more than happy to pay that patient responsibility. And as sort of technology becomes more advanced and as things become more convenient, patients are going to want to pay as well at the point of care. If you enable the payment, if you make it easy for the patient to make a payment, they're going to make a payment. I've gone into a lot of medical offices, and you'll see that there isn't even a way to swipe a credit card. There's unless someone is asked, the patient never sort of says, oh, look at this credit card machine, or look at this kiosk, or look at this device that's looking for me to scan my card. There's nothing in there to engage the patient. As the technology grows for a lot of that, the patient's going to walk into the medical office and they're going to see something that they see at a CVS or at a Walgreens, which is a cash register type device or a credit card terminal type device where they can actually make a payment. The idea of the patient just visually seeing that type of technology gives the patient the idea that they're actually going to have to pay. Patients certainly want updated billing practices. 95% of consumers, patients, said that they would pay if their provider had an online portal. So if they got a bill in the mail after the fact, which is still pretty common, but the idea of writing a check is not that common anymore. So if they can go to a website and click on a payment link, and they can go to that website whether they're on a phone, whether they're on a computer, and they can quickly make a payment, especially from their phone. A lot of phones these days will store your credit card information in the phone. A lot of browsers these days on computers will also store your credit card information. So when they go to the site, they click pay a bill, it displays their dollar amount, and then they simply just pay. So it makes the whole process very frictionless, very easy, and allows those patients to make more payments to the offices. Kind of on a little bit different vein, it's a compounding problem. Insurance companies, as I mentioned before, have gone through quite a bit of effort to increase that patient responsibility and take the burden of paying for those early healthcare expenses, take the burden of paying that from the insurance company, shift it to the patient, take the burden of collecting it and shifting it to the providers. There's also a lot of pay-for-value models that are coming out now where the ability to get insurance dollars is also going to get more difficult. So there's a compounding problem of consumers are paying more now, and insurance companies are now coming up with a new way to pay even less. So that if we can address that consumer portion, we can start to win the battle. So creating a consistent patient payments and improving the RCM, make healthcare a priority. The doctor bill should be important. As I mentioned before, that counter effect, where the bills pile up on the counter, specifically the medical bills, shouldn't be the case. These are payments to providers that are keeping patients healthy. These are payments to providers that are keeping patients alive in some cases. That bill shouldn't be falling below the mortgage, or shouldn't be falling below the electric bill, or shouldn't be falling below some other bill that seems to be more important that particular day. The medical bill should become the top priority. And there's technologies that can assist with this. Asking patients for insurance information at the time the appointment's scheduled. There's an app for that. There are a lot of apps out there now where you can get that information from the patient digitally. Familiarize staff with high-deductible plans. Familiarize staff that, it's not necessarily a copay anymore. For the longest time, we pushed front desk staff to say, look for a copay on the insurance card. Well, there isn't a copay on the insurance card anymore. Now there's actually, a lot of times there's nothing, but there may be a deductible on there. And if there is a deductible on there, how do we get that staff to engage with the patient to say, you're going to have some financial responsibility? It's okay for the staff to ask for payment. I think that in a lot of environments, that isn't the norm. In some it is, and I like the ones that do, but in some it isn't, where the patient walks in, the patient receives services, and the patient leaves, and no one asks that patient, well, how do you plan on paying for your services? And they certainly have insurance, but they certainly know their insurance has a deductible, so it's, how do you plan on fulfilling your deductible today? So there's a conversation that the front desk staff can have as well. There are a lot of technologies out there. Excuse me. There are a lot of technologies out there as far as patient portals, mobile options, where patients can make payments. And if they can be engaged through the patient portal, if they can be engaged through a mobile device, any way that makes a patient want to pay, we want to facilitate. Excuse me. If you need to allow a patient to pay installments, you need to allow a patient to pay via Apple Pay, via Samsung Pay. All these types of technologies are actually very, very inexpensive. They're part of something most practices are already receiving, which is merchant services. These can be layered on top of merchant services very easily, and what they do is they allow more ways for patients to make payments. And they essentially reduce the friction that I mentioned before around asking for payment. If a device can do it, if they can pay via a portal, there's definitely ways to collect it. In addition, offering more flexibility, paying in installments. So if there's an outstanding balance that needs to get paid and it's large, certainly offer installments against that outstanding balance. Discounts for prompt payment. If a patient has a really high balance up front or even a really low balance up front, you can certainly offer a discount if they want to pay day one. And that payment could be in full of their deductible, and then they can get a refund back. That payment could be in full of the balance due minus a discount. There's definitely a lot of ways that you can offer that. Also, recurring payment plans. If a patient is coming in consistently for something, physical therapy is a good option for this. Anything, cardiology therapy, things along those lines. You could basically say to the patient, hey, we know you're going to be here X times a month. That's $30 a month. We're going to go ahead and offer a recurring payment option against those services. So there's a lot of options on the flexibility. The biggest underutilized option is what we call card on file. And I think card on file is something that the healthcare industry can really utilize to solve almost everything I've talked about in my presentation. Card on file is used everywhere in the consumer experience. I know landscapers that take card on file. I know Amazon does it, so whenever I log into Amazon and buy something, I never have to enter in my credit card information. Netflix is probably one of the early adopters of card on file, and has certainly made it the core of their business. You cannot sign up for a Netflix account without putting your card on file. Interestingly enough, for everybody on the phone, Netflix's days in AR happens to be 0. Their paper statements sent out at the end of every month also happens to be 0. Because Netflix, in order to register for their services, in order to have their plan, you need to put a card on file. I think card on file for healthcare can do the same thing. It can really reduce, it can really almost eliminate paper billing, and it can eliminate patient days in AR, at least. Not insurance days in AR, but certainly patient days in AR, where as soon as you know what that patient balance is, if you have a card on file for that patient, and that card on file doesn't have to be their, day-to-day debit card for grocery store purchases. It can be their FSA card, it can be their HSA card, whatever card they have set aside for healthcare expenses, it can be that card. And they can be notified before the card is hit. There could be parameters on that card, but card on file really allows you to process payments, apply payments to outstanding balances, set up recurring scheduled payments. It allows you to have that better patient experience. It also makes it so that the patient experience is relatively frictionless, meaning if you can get the card on file ahead of time when the appointment's scheduled, when that patient comes in to see the provider, they're going to walk in to see a provider, they're going to walk in for their hospital visit, they're going to receive their services, and they're essentially just going to leave. The office, the facility has the card on file and can hit that balance at a later point in time. And if you don't get the card on file at the time of registration or at the time of scheduling the appointment, you can get it the very first time that patient presents at the office or the very first time that patient presents at the health system, and you can allow them to have it on file for all subsequent visits. A lot of health system customers actually can take it at one office, and it's available to other offices within the health system. So there's ways to definitely manage it, but I think it's the most underutilized facility for capturing patient payment in the space. And so many other spaces in the consumer area have definitely leveraged it from, Netflix, Uber, all the different options that I've mentioned. As outlined, I think things are changing. Capabilities exist. Patients are becoming more engaged. There are payment technologies out there. Back 20, 25 years ago, everything was cash or check. If you bought something, it was cash or check. Today, very few people carry cash or check anymore. It just doesn't exist. So the payment networks of the world have really made it so that consumers and what we call merchants can collect from their consumers relatively easy. The same technology, the same products, the same functionality can all be leveraged in the healthcare space. That concludes the presentation portion. I think we're going to open it up for some questions and answers.
Thank you, Mike, for that excellent presentation. So we will now begin the question and answer session. As a quick reminder to our audience, please submit any questions you have by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. And we'll try to get through as many questions as we can today. All right, so let's go ahead and get started. Mike, our first audience question is, which practice management systems can you integrate with?
Most practice management systems our technology can integrate to. So in the hospital space, the Cerners of the world, the Meditechs of the world. In the smaller practice space, the NextGens of the world, the GE Centricities of the world. We set up our system to integrate the payment functionality and to integrate that point of care payment functionality with most practice management patient accounting systems.
Perfect. Thank you for clarifying that. So we have a lot of great questions coming in. This next one is about credit card security and regulatory restrictions. So this audience member asks, healthcare systems are concerned about credit card security and regulatory restrictions. What solutions exist to overcome these barriers?
So within the credit card space, there's PCI security. PCI security is payment card industry. Payment card industry security actually existed well before HIPAA compliance existed. So payment card industry requires a certification as well. So unlike HIPAA compliance, where you kind of state that you follow the rules, in order to deliver credit card processing, in order to deliver it in a compliant manner, you actually have to be certified by the payment card industry. So the recommendation would be is to make sure your vendor provider is certified, PCI compliant, and provides the proper tools for that. And the PCI compliance will also essentially come with HIPAA compliance because the rules for PCI are much stricter than the rules for HIPAA.
Excellent. Thank you so much for clarifying that. That was a great question. So we have a question from the audience that says, for patients that only have cash, what do you recommend? Our organization is wanting to get away from accepting cash altogether, but I'm concerned that we won't get paid by some patients if they only have cash for payment of services.
It's a great question. The debit card or the credit card is growing quite a bit. So even consumers that don't have bank accounts, we'll take hourly employees at a large organization like McDonald's. They don't have bank accounts, so McDonald's was issuing paper checks, and then those employees would then be going to cash checking places and they would cash the check. This actually got switched out about a year ago, where now they issue a debit card to these employees and they fill the debit card every single month. So the reason I highlight the example is I think if you went to the point where you stopped taking cash, you'd be surprised that just about everybody has some sort of debit card. They're not just given out when you open a bank account. They're also a lot of times given out when you end up getting a job or getting a position. Even food stamps now are issued on debit cards. So you'd be surprised that if you just sort of drew the line and said no more cash, you'd be surprised at how many people magically have a debit card.
That's really interesting about the debit cards, and thank you for clarifying that. So our next question is back on the topic of security. So how do you ensure patient data is safely stored?
So all data is stored sort of in the same server environments that store credit card data. As stated earlier, the rules and restrictions around storing credit card data are much stricter actually than the rules and restrictions around storing patient data. So it's stored in a compliant manner. It's stored in an encrypted environment. To even give an example, and I'm sure a lot of people have heard of AWS, where you could store things at Amazon. The credit card industry won't let you do that. The credit card industry requires that you store your stuff on actual servers that you have access to and that you own. So the data control policies are much stricter for credit card. When we end up processing patient data along with credit card data, it gets put into the same environments, and nothing's impossible to hack, but it's very unlikely that any of that data would get compromised.
Absolutely. Thank you so much. So our next question, this is an interesting one. Are there any security issues to be considered for installments on credit or debit cards, since the patient may cancel the card or may not honor the payment?
Yep, absolutely. So, interesting fact that credit card that we all carry around in our wallets actually doesn't belong to us. It belongs to Visa, MasterCard, Discover, American Express. And if a patient puts that on file for a recurring payment plan, and for some reason that patient cancels that card or that card expires even, there's actually a process where you can call up to Visa, MasterCard, Discover, American Express electronically and get updated information for that card. So that it's not really a security issue. It's more of a securing the payment type issue. But once someone leaves a credit card, once you get signature, which would be enabled for that as well digitally, you can actually identify other sources of funds for that patient for payment, whether it be from Visa, MasterCard, Discover, or American Express.
Thank you. That's really helpful to understand. So these next couple questions are more about the technology side. We have an audience member who asks, how long does it take to implement your technology with ours?
Depending on the size of the practice or healthcare facility, I'll give a range. So for a 5 to 10 doc practice, it takes a day. For a 500 to 600 bed hospital, it can take 3 weeks. But generally speaking, it's a short implementation time for a smaller practice, medical practice. As the organization gets bigger and more complex, that adds more time to the implementation.
Absolutely. So 1 day to 3 weeks, still pretty short. So this next question, does my staff need to be trained to use your software?
I think there's always a training component to any new software. So, an hour-long remote training will get most staff fully trained on the software. Remember, though, most staff are already taking credit cards, so it's not like we have to train them on that part. Most people are already pretty adept at using credit cards, so they know the patient experience. The ins and outs of any software product, we certainly have training for all of our users. I would say an hour remote session gets everyone up to speed.
Absolutely. Thank you so much, Mike. All right. It looks like we have another question coming in here. So why should consumers choose Rectangle Health over other vendors?
I think that the decision is our focus on healthcare. We don't do that. I know I mentioned a lot of other industries that utilize credit card processing and utilize payment technology, financial technology. We only focus on healthcare. So we take that technology from a Netflix, from an Uber, and we utilize that technology in the healthcare space. We don't do gas stations. We don't do grocery stores. We are focused specifically on healthcare and healthcare only. And we've been doing it for a very long time. We actually started this process about 25 years ago, and our hot technology of the time to deliver to a medical dental provider was essentially one of those old credit card terminals with the little yellow receipt that came out of it. That's what we were delivering years ago. Today, we deliver much more cutting-edge technology, but it's always been about getting the provider paid at the time of service or getting the provider paid in a more efficient manner than sending out a paper bill and hoping for the best.
Thank you, Mike. And it looks like those are all the questions we have, and that's a great way to end. So do you have any final thoughts you'd like to share with the audience today?
Again, I think that the audience and the providers in general, I know everybody is getting sort of squeezed from the insurance companies, but there are tools and there are methods out there to collect more money from patients. And if you utilize those tools and the patient can pay in a way that they're used to paying just about every other consumer, or just about every other facility for payment, if you utilize those same methods, patient payments will increase.
Thank you so much, Mike, for sharing your insights, and thank you to Rectangle Health for sponsoring today's webinar. To our audience, please enjoy the rest of your day, and we look forward to having you join us for future webinars.